Hello and welcome to Autistic FM. My name is Haje. I use he, him pronouns, and I'm the trumpetist that keeps this jazz band hurling along at breakneck speed. You can subscribe at Autistic FM wherever you get your podcasts, and it would be really awesome if you did. That's how we grow and thrive, and that's how more people find out about us. Please share us widely and tell all your friends about us. Okay. Over on our website at autistic.fm, you can find episode transcripts and additional information. We also have discussion threads for each individual episode, a neurospicy discussion forum, and much more. And all of that is free. If you become a supporter for as little as $5 a month, you can get a sneak preview of the topics that we have coming up. And you can even submit questions for our guests. You can also add topics for our future topics wish list, and you can get access to supporters-only discussion groups. And we have a bunch of additional supporter treats coming up, so stay tuned. In this episode of the podcast, I'm excited to be joined by Lauren Howard. She's known as L2 among friends, and she's an expert in the field of neuro-affirming mental health practices. Lauren's innovative approach to making neurodivergent diagnoses more accessible and humane is absolutely rad and super inspiring. A quick trigger warning. This episode does contain discussions about sensory processing issues, meltdowns, mental health struggles, and the trauma associated with workplace environments. Please look after yourself and listen accordingly. With all of that out of the way, let's roll the tape. Hello and welcome back to Autistic FM. I am joined by a very exciting guest this week. A very exciting guest. What is your name and what pronouns do you use?
Hi guys, my name's Lauren Howard. I go by L2. You can call me either. And my pronouns are she, her.
Awesome. You have to say something about L2. Where did that come from?
It's not as, it sounds fun and it's fun. Years ago, I was the second Lauren on a team and they couldn't keep us straight. And so they started calling us L1 and L2. Ironically, now, all these years later, L1 is also running a mental health company. We run different mental health companies and we weren't in the mental health space at that point. But when I left that job, part of the struggle was that I felt like I was like leaving my identity behind. Everybody called me L2 and I was like, are they allowed to call me that anymore? And I just had this moment where I was like, wait a minute, just because I don't have this job anymore doesn't mean I have to give up my identity. And so that day I went out and incorporated L2 LLC and I had no idea what I was going to do with it. It's now on my wall. And bought the domain name. And then as I was dealing with like paperwork for separation from that company, I got to email them from lauren@l2.com. And I was very pleased with it.
That's beautiful. I want to talk more about that because there's a couple of interesting questions in that. But at first, I want to finish my standard questions.
Oh, yes, go for it.
What is your history with neurodivergence?
Currently, I run a neuro-affirming mental health practice, and we do a number of different services for people who are either already diagnosed neurodivergent, self-diagnosed neurodivergent, or suspect that they are neurodivergent. I've been in mental health for most of my career, which is like going on 20 years now, and this is the space that I know best. I think I have a unique personal experience with neurodivergence in that I am absolutely definitely neurodivergent. There's no part of my brain that is neurotypical. But I was also raised in a house where it was just like treated like normal. Nobody ever called it out as something that was bizarre. It didn't really affect me in school. The ways that it did affect me, my dad was a psychiatrist and he just adapted. And so I run a program and multiple programs where we help people achieve diagnosis if that's what they want. And I've never been diagnosed with anything and I don't really plan to. So where I fall on it, it's fine. Whatever, we'll figure it out.
Right. Right. But you identify as neurodivergent yourself.
Oh, yeah. I have sensory processing issues out the wazoo. Don't send me into an Apple store. I will I will just have a meltdown. And the irony is that I met my husband while we were working at Apple. So like, for some reason it was different when I was working there, but now you send me in and I'm like, too many people, too much. I can't do any of these things. But yeah, so I don't know. We've come to this part of life where we just perceive things differently, I guess.
Yeah, I love that. It's interesting that you're talking about, like, you seem blasé about whatever, I am who I am, I don't need a diagnosis. Would you say a little bit more about that? Because I feel like a lot of the people I talk to are like either don't want a diagnosis or want one and haven't got one yet. I like the, I don't really care approach.
I won't say that I don't really care. I would just say it wouldn't change my life to have one. I was very fortunate to be brought up in an environment, like, for instance, I can't tell left from right, and I've never been able to. My brain doesn't see things as upside down. So, like, I know that sign behind me when I look at it in my camera is backward, But when I
Word,
look
yeah.
at it, it doesn't look backward. That's just the way my brain is. I remember hanging off monkey bars as a kid and like forgetting that I was hanging upside down because nothing looked upside down, right? And it definitely growing up in a house where I could say that to my dad and he was just like, oh, okay, well, let's not fall off the monkey bars because you don't know that you're upside down, but also like this. And he put a newspaper in front of me upside down and I read it and didn't realize that it was upside down. And his response was not like, oh, that's a problem. His response was, oh, that's interesting. And it just
Right.
became part of, and again, I remember struggling when I was learning to drive because people would be like, go right. And I would be like, I don't know what that means. And I'm ambidextrous. And so it like doesn't get better. And so I remember saying something to him and him just saying, everybody's got like 4 learning disabilities at least, and that's one of yours. And put L&R in your hands and you'll remember. Or
Right.
you'll at least you'll have a visual. And it was just like never a thing. It was never something that I needed to be ashamed of. It was never something that I needed to be concerned about. It was just like, all right, how do we adapt? How do we make this work? Oh, you don't want to do that? Okay. Oh, that's not comfortable for you? All right, let's not do it. And every problem that was a barrier had a solution. I don't think you get to be this bombastic, like rule ignoring, loudmouthed whatever without growing up in that environment. And I've gotten this far in my life. I run 4 medical practices. I have a husband who happily tolerates me, mostly happily. I have my kids. There's nothing that's coming from inside my brain that's a barrier to success right now. Now, if I woke up one day and it was, and it has been in the past, there was a time period where I hit the couch and I was there for 5 months because I burned myself out so badly I couldn't move. I went and found the help that I needed for that. But in that, I'm just happy staying in my house and I don't really need to go out a whole lot. And when I do, my husband knows when to be ready to elbow people because they're too close to me. That's the daily impact of it because I've built a world that works for who I am and no one's fighting me on it.
I think that's a really good kind of life philosophy almost. Build a world that works for you kind of thing, right? I'm
Well, and you know what?
really resonating with that.
Of the patients that we see who come in for their autism diagnosis, and my take toward it does not have to be yours. There are lots of people who want to know more about this and know more about their brains, and that's completely valid. But I would say almost 50% of our patients are self-employed for that exact reason. They went into a very corporate environment. It was either difficult for them or just not what they wanted out of their lives. And that autistic pattern recognition, they were able to go through and see the things that they enjoyed, see the things that they would be happy doing every day, recognize the things that they had no interest in doing every day. And when they eventually left, they built the job that had the parts that either fed their soul or that they felt like they could comfortably do every day. And they left everything else in the corporate world where they didn't want to be anyway. It's very resonant with neurodivergent brains and this idea that like our workplaces were not built for those brains. And so a lot
Yeah.
of people are just like, well, then I don't want that workplace. And I get that.
Yeah, and there's a different strand there, which is a huge amount of unemployment for a very similar reason.
And I think that's obviously it's a different side of it. And we tend to see hyper employed people because of the services that we offer, which tend to focus around employment and autistic burnout and things like that. But you're right. I think there is the other side of it, which is when we see the people who tend to be able to master their own executive dysfunction into moving forward and doing other things. And those tend to be our patients. Now, that doesn't mean that there isn't another side of it that we don't see as much because either they're already diagnosed or they don't have access to the same resources. I will say, as we get closer to taking insurance, and which we are hopefully only a couple of months away from, and over the next couple of years, as we expand to all the various and sundry Medicaid plans, which will be like a whole ass thing, I'm sure we'll see a giant shift toward people who need much more significant accommodations, which we're equipped to handle, and people who, instead of making their own career path, have dealt with the significant history of unemployment as because they can't find a workplace that's comfortable for them or that will accommodate them. And I'm sure that scale will balance.
Yeah. No, I love that. I want to tell you a brief story about how I found you. Because I was pursuing a diagnosis for myself, or at least some sort of diagnostic process. And I'm with Kaiser. And they're like notoriously bad for mental health anyway. But I went through a bit of a mental health wobble about a year ago and reached out to them. And they actually gave me a referral, which was amazing. A referral to an outside person, a therapist and psychiatrist that specialized in autism. I was like, great. But then there was a tiny quirk somewhere on the paperwork that meant that the billing didn't match up. And so they were like, oh, well, and I actually contacted them at some point. It's like, hey, please take my phone number off your files. I never want to receive a phone call. I am very anxious when my phone rings. As far as I'm concerned, it's a supercomputer, not a phone, right? I don't ever want to receive a phone call. And the amount of hassle I had to go through to get my phone removed, I actually ended up writing a letter of complaint, which I was like, please, I only ever want to be emailed or messaged. I never want to receive phone calls. And they didn't respond properly. And they were like, okay, for any questions, you can call this phone number. I was like, did you not read any of the stuff? And a separate part of that is like the first screening call I did, this person was like, oh, yeah, adults can't get autism. I was like, you're my fucking healthcare provider. And that is patently and objectively not true. I don't know why you're in the screening process, because this is harmful. Anyway, I took a breath because I've been taught that. And I was like, okay, clearly these guys are aggressively ignorant about autism in general and adult autism specifically. I wonder if there is a neuro-affirming thing out there. And that was the beginning of my journey that led me to you. And so thank you. I paid for it. This is not a sponsorship thing. I look forward to using your service. And now I am super curious. How did this come about? And why is this important to you?
It came about because we were on the other side of the situation that you dealt with.
Uh-huh.
And we were always going to be neuro-affirming. That's germane to who we are. But we were not targeting people with autism spectrum disorder at all. It wasn't our cohort. It doesn't mean they weren't welcome. We didn't plan to have more expansive services for them. But we deal a lot with people who are experiencing burnout, toxic work environments, workplace trauma, and you rarely find a person with either ASD or suspected ASD who hasn't experienced some of that. And
Mm-hmm.
it's not that we didn't know that, but seeing it in living color in front of us was pretty wild. And so our patients who started actually coming to our groups, because we have psychoeducational groups on burnout that are designed to be something in a world that a lot of people have nothing. And so you can come and sit with a therapist who is not providing therapy. We're providing peer support groups. It's therapist led, but not therapy. And for $20, you can surround yourself in a safe, supportive environment. Again, when we started, these were heavily targeted toward burnout and toxic work environments and things like that. And the number of people who would come out of those groups and contact us and say, I really feel like I need to be tested for autism spectrum disorder because I think this is autistic burnout and not just burnout. Can you help us, or can you help me find someplace? And I would say, yeah, not really. Like,
Yeah.
I'd be happy to try, but I don't think we have better resources than you do. And after being in this field for as long as I have, I'm not a clinician, but I understand both the complexities of mental health diagnoses and neurodivergent diagnoses, I guess is a better way to put it.
Mm-hmm.
And I also understand the simplicity of them. And I think we do a lot of work complicating what can sometimes be very simple processes. And I don't even mean the bureaucratic part of it. Why do you have to sit for 10 hours of testing on something that is a clinical diagnosis that there's no big book of things that says you have to do testing? Now,
Yeah.
should you? If the testing is available, sure. And not only for the sake of doing the testing, but also some people just communicate better in writing. And so
Mm-hmm.
having testing and having an opportunity for them to write how they feel instead of talking about it in real time gives you very robust, varied data that will help certain people who just don't communicate well to communicate well live. And that's okay. So of course it got in my head. There was a bug. And I always try to sit on things for a couple of weeks. And if they're still bugging me, then I'm like, all right, we might actually have to build this.
This described ADHD perfectly, I think. Not to diagnose you or anything, but
Yeah, no, it's,
anyway,
yeah.
so once you have your thing.
So I started doing a ton of research. I talked to everybody I could get a hold of who had a background in this and just asked the question of, I kept asking it over and over. Why is it so complicated? Why is it so hard to access these things? Why is it so expensive? And of the 20 or 30 different hyper qualified, experienced, etc. clinicians that I spoke to, not a single one could give me a firm answer as to why. And a lot of them, not a lot of them, a handful of them, if you ask what radicalized me, a handful of them said things like, well, if TikTok will tell you one thing, but if you've had relationships and you're able to hold a job, then you can't be autistic. And I was like,
Cool.
thank you for your time. Really appreciate it. gonna go bleach my brain.
But it goes both way, right? There's this guy, I'm holding up a DSM-5. This guy will tell you like 5 bullet points in 2 categories about what
Yeah,
autism actually is. And I'm like, okay, so translate that to me to a 10-hour diagnostic process. It
right.
feels very
Right.
overkill. And it sounds like that's the same place you ended up.
Yeah, exactly. And I happen to have a wonderful academic team that we work with that serves as some of our clinical advisors. And I went to them and said, all right, I've done a ton of research and this is what I'm thinking. 1, I need you to tell me if I'm losing my mind. And 2, I need you to tell me if this is possible. And our primary advisor out of there said, I'm almost positive it's possible, but you're going to make a lot of people mad. And I was like,
Bring it.
I don't think that's a deterrent for me. I think I'm okay with that. That's fine. And so we set out to go, like, how do we simplify this? And we do have testing. We use a validated assessment. We use a written structured interview. We have an in-person structured interview. It takes a minimum of an hour in person. It can take longer. Our clinicians are empowered to use as much time as they need. We don't tell them how to diagnose. We don't tell them anything having to do with a clinical decision. We just give them all the tools. We do have pretty strict guidelines on how we approach patients, how we approach disability, how we discuss things like eye contact. And so those things are really important to us, but that's all bedside manner. That's not clinical decision making. Put it together, and I thought, man, I'm never going to find a single psychologist who is willing to do this because we're just a scrappy little startup who have been using our clinicians to put this together, and they're all going to look at this and say, this is not how we do things. And 14 psychologists later, we have an entire team of people who are fully bought in on this process and are doing really good work. Really, even our patients who are not autistic are satisfied because they're treated like humans and they're listened to and they're given access to services beyond just their assessment. And we answer questions and actually like answer emails and stuff. And we call very
God
rarely.
forbid.
We call very rarely. That's the thing about having a team. Like our team is like 85% neurodivergent, which means none of them want to get on the phone. So we have all sorts of ways. We have 4 different ways that people can contact us. You can chat, you can text, you can email, and you can call. Because there are some people who are only ever going to want a text message, even if
Right.
email is right there. But it also means that they know that like you don't give people 4 different ways to contact you if you don't want them to contact you.
Right.
And so it just like very clearly sets that standard. After we were in process for our autism assessment for probably about a month, my inbox was flooded with people asking for the same process for ADHD. And I
Mm-hmm.
truly had not really considered it because it's so much more complicated to do via virtual care. We can put a diagnostic procedure together, but we can't treat people in 50 states if they need stimulant treatment. And so it's just a different beast altogether. So we went back and did the same thing, and we sat down with the clinical team and the academic team and said, is this a thing? And I think ADHD is in general more straightforward. But the bottom line was the things that we took out of it that we wanted to fix the most was first that you have people coming to you complaining of overwhelm and executive dysfunction, and then we're making them sit for 20 hours of testing.
Right.
Can we trust those results? Not sure.
Maybe the test actually is whether or not you complain halfway through.
Right, exactly.
Bullshit.
Yeah. Yeah.
Congratulations, there's your diagnosis.
There are some things on the written assessment that we do that we know will strike certain brains a different way. And the response to that is really telling as to like, there's 2 responses on there that we call it our autism stamp. We're like, autistic. Because we deliberately use a word that's nebulous to see if they get the colloquial explanation or colloquial definition of it, or if it's like, in this context, I have no idea what this means. And that is really little tiny nuanced things like that are really telling for what is actually happening inside your brain. And that takes all of 30 seconds for somebody to go through. But the other side of it is that this established testing that we have that people spend 10, 12 hours going through to achieve diagnosis or to get closer to a diagnosis is all built for young white males. That's all it's really been
Yep.
validated for. And so there's this notion out there that men or boys are more likely to be autistic than women. And we don't actually know that. We just know that our testing is more likely to identify them. Now, there's a
Yep.
little bit of data that shows that there might be a slightly higher incidence in men, but we're not talking about what we're seeing now, which is like 8 to 1 or something crazy like that. And so it became less about fighting against the criteria, which was never part of our goal, and more about how to ask the questions in a way that somebody who's not an 8-year-old boy will understand and be able to respond to.
Do you have an
And
example?
yeah, exactly. So everybody's pretty familiar with this idea of autistic meltdowns, what we are moving toward calling sensory assaults. So you get so overwhelmed by your own senses that it feels like you're being attacked. And you're trapped. The walls are closing in. You can't regulate your emotions. You can't figure out what is causing this, or even if you can't control it right away. And it's one of these things that if you were to say, oh, well, I've never had a meltdown in public over a noise that made me feel uncomfortable, they'll go, oh, well, you're probably not autistic then. Well, what we have not accounted for in those questions is that is a very typically, traditionally male way of responding to overstimulation. So if you go to a woman or a femme and be somebody who does not identify as cishet male, and you say, have you ever had a meltdown in public because you were overstimulated? 9 times out of 10, they'll say, oh God, no. That would be mortified. That'd be awful. But if you say to them, have you ever felt so dysregulated by something that happened in public that you went home and broke into tears, cried for a long time, couldn't regulate your emotions, shut down entirely so that you had no feeling? They go, oh yeah, that happens like once a week. Well, women have been taught, women, femme, NBs, etc., have been taught that you don't draw attention to yourself in public. People will think you're weird. They won't like
Mhm.
you. You won't be welcome back into the friend group. You'll be ostracized. Even women who don't like people tend to be very social creatures and want to feel like they fit in. And so women and girls are taught very early, do it at home, do it in private. And so the impulse is the same. They're still having a sensory overload. They're still having a dysregulating event. They're just not screaming and crying in public. They wait until they're in an environment that is safe enough to have that meltdown. Because also remember, women do most things while watching out for violence. So if you were to be screaming and crying in public, would that create an unsafe situation for you beyond the unsafe situation that your body is actually creating or your brain is actually creating? So when you ask it in that way, do you go home and scream or cry or feel like you can't control your emotions anymore or shut down or be completely non-communicative because of whatever just happened? They go,
Right.
oh yeah, that happens once a week. And
Yeah,
that's the
that's a
same
really
thing.
good distinction. It's the same thing with, like, often they ask questions about socks, and I'm always like, I don't have a problem with socks. I have a whole system for socks. And like, maybe that is having a problem with socks.
Yeah, exactly. Exactly. You're not like, I can't handle the seams on a sock, but you are like, right. So the red ones go here and the blue ones go here. And if the blue ones and the red ones mix, that's a problem. And yeah. And you're right. That's one of the questions that some of these tests ask is like something along the lines of, do you have a problem talking about your interests? And what they mean is, are you ever overly communicative about your interests? Do you ever make other people uncomfortable talking about your interests? And
Right.
what an autistic brain tends to hear when you say that is, oh no, I have no problem with it. I can talk about it for days.
Yeah, for hours, no problem. Let's go.
And you're like, okay, well, you're going to answer that question in the way that is correct for you. But that's
Right.
because that question was not written
But
with your
diagnostically,
brain.
it goes the wrong direction. Yeah, for sure.
Exactly.
And similarly, even in the way you describe that, I was like, well, other people's discomfort, is that my problem? Like, how is this? It's one of those things where I'm like, if I try to logic my way through it, like, I'm moving house and my future landlord was like, do you work from home? And I was like, I don't know how to answer this question. Like, ever? Yes. A lot of the time, yes. But what do you actually, like, why are you worried about that? Are you worried I'm going to be noisy, use too much electricity? Like, I don't understand why you're asking this question. I'm not even sure if it's entirely legal to ask this question. But I'm also like, I want this apartment. So do I answer this in a way that makes me get the apartment? Or do I answer this in a, sorry, I need more information about your very complicated question? Like, how autistic am I going to be about this?
Right. That neurotypical person thought it was just like a piece of conversation that, oh, sometimes I want to know what you do during the day because I want to know if we can drop by if we need to. He's got some
Right.
very simple reason. And an autistic brain goes, this could be danger. How do we make sure it's not danger? And some of that is innate, some of that is a trauma response because of the way that autistic brains often get treated. It's one of these things where I get very enraged when people talk about eye contact and how eye contact is an indicator of autism spectrum disorder or not autism spectrum disorder. And it drives me crazy because especially millennials who were raised by boomers for the most part, kids were literally abused into making eye contact.
Mm-hmm.
So there are very few people who don't get a diagnosis as a child. Like somebody who doesn't get a diagnosis as a child because they're just getting through life and they didn't realize that these things that make them uncomfortable but are not always functionally disabling are diagnosable. They get through it by adapting when they see danger.
Right.
And so if somebody's going to come to you and say, "Look at me when I'm talking to you," and the consequences, if I don't, I'm going to get hit, or if I don't, I'm going to lose my privileges, or I'm going to be unsafe, or something like that. You learn to stare between someone's eyes, and they think you're making eye contact, and you're elsewhere, and you're probably paying way less attention than you would have been if you were allowed to not make eye contact, because now you're focused on making the eye contact. But this idea that people can't learn to control their discomfort and stims when the environments we put them in are often literally abusive to those things. And then when people go as an adult and go, "I think I might have been autistic my whole life and nobody noticed." And the
Mm-hmm.
answer is, "Yeah, but you make good eye contact and you're able to manage in friend groups." And they're like, "Okay, but I'm dying inside when I'm looking at your eyes. But it's the
Right.
only way that I could avoid getting punched in the head." And so now they're literally being penalized for the fact that their brains recognize patterns and they knew that if they did this thing, it would keep
Right.
them out of trouble or keep them out of danger. So in some ways complicates the diagnosis, but in other ways makes it really simple. That, hey, did you have somebody who forced you to make eye contact when you were uncomfortable as a kid? Was there a threat there that if you didn't, there would be consequences? Did you learn to do that so that you wouldn't get hit or have whatever consequences there are? And then the other side of it is we see people who learn to make such good eye contact as a way to show that they are making eye contact that they might as well be like looking with x-ray vision straight through your head.
Right.
Like,
We're like, hey, it's creepy how much you look at me. Make up your mind.
yeah. And they're like, "But I am literally doing what you told me I had to do to be safe as a child. And
Yeah.
now I'm doing that wrong too. I don't understand." And it's because most of the rules are arbitrary, right? And so explaining why you have to follow this arbitrary rule is hard. But once they decide they're going to follow it, they follow it.
Totally. I
And
still count in my head like for 8 seconds and then look away. At some point, somebody said, just look between your eyes for 8 seconds and then whatever. You can look around a little bit and then go back to doing that for 8 seconds. And I took it so literally that in my head, I started counting 1, 2, 3. It turns out when you're counting in your head, do you want to know how well you're actually listening to the other person? No.
yeah,
So my conversation skills went out the window for a while, but then I got better at counting and listening at the same time. And I still do
right.
it. It's a thing.
Yeah. So, and even well meaning things like that can amount to abuse. And people are going to respond to abuse. They're either going to respond by complying so that you stop abusing them, or they're going to go the absolute opposite direction and respond by letting these events be dysregulating so you leave them alone. Yeah.
Essentially, you're just fawning. This is the way to be safe is fight,
Yeah.
flight, or fawn in this case.
Yeah.
And I'm gonna fawn.
Yeah.
And it's one of those things where, well, and freeze, right? Sometimes it's just go nonverbal. So you end up
Right.
with all of these trauma responses. And then eventually they get beaten out of you one way or the other because somebody goes, that's not an appropriate response. Well, if somebody would just model for me what you want me to do, I'll do it, kind of thing. But
Yeah.
that's,
Exactly.
yeah,
If you show me, I'll mimic it. It won't be genuine. I will literally just be
right,
copying what you're doing, but I'll do it.
right.
And I think we are just starting to truly understand the amount that people who are, because late diagnosed autism is not a thing. Well, late diagnosed is. Late onset autism is not a thing. You were always autistic.
Right.
These specific diagnoses are not things that pop up in your 30s. If that happens, it's probably more related to trauma or a mental health diagnosis or something. And that happens. One is not better than the other. They're all mental health things. They all have different interventions. It's not one is preferable to the other. But this idea of people coming around to the idea that they might be autistic in their 30s and 40s is very deeply coupled with understanding how much of their quote unquote normal behavior, the things that they do to make them normal, are tied to trauma. Because you don't change your behavior unless there's a reason to do it. So
Mhm.
you don't change the way you wear your hair and the way you dress at school, if you like it, I should say. If a kid isn't mean to you about it, you don't stop wearing glasses and start wearing contacts and cut your hair short if you liked it the old way, if there isn't a reason to do it. And so
Right.
usually the reason that we find is kids who are taught 20, 30 years ago that you have to be normal. Normal doesn't exist, but that you have to be normal. And to be normal, you have to do one of these things or all of these things. And that means forget the things that are your instincts, your impulses, the things that you're comfortable with, and pretend to be this person. And all of that comes out of trauma. All of it comes from a lack of psychological safety, the inability to be yourself in public, the
Yeah.
inability to relate to other people, and this feeling like maybe if I'm someone different, I can relate to these people and have friends. All of that is traumatizing in some way.
Yeah.
And so we're getting to these people now who go, oh, wait, I think I felt like that for most of my childhood. I think I had friends, but it was because I was forced into this. I did sports. And so they had to take me everywhere, but I never felt like they understood me. And I certainly never felt like I could tell them about the things that I was interested in outside of sports. And wait, you mean I can talk to you about Dungeons and Dragons for 4 hours and that's allowed?
Right.
Oh, so what was I doing for so many years when I was deliberately not talking about it or only talking about it in my brain or only writing it in my journal so no one would know that I was so interested in whatever? One, you were doing what it took to keep yourself safe in the environment that you were in. And two, you were the byproduct of an environment that, whether it meant well or not, created trauma for you that made you change the way you behaved and mask and do all the things that people do to protect themselves.
Yeah. Oh my God, this is bringing up so much stuff for me. It's wild. What I love about what you're doing is that it's scalable. Like every therapist I've ever had at some point, hey, have you thought about being a therapist? And I was like, interesting. You're trying to recruit me to your side. But the thing that always held me back was like, look, it is God knows how many years of education, plus all the kind of interning and that kind of thing. And even after all of that, assuming I still live in this country and I'm licensed in the right place kind of thing, even after all of that, I can only help one person at a time. And I hate doing stuff that doesn't scale. And of course, the ripple effects of the people you help has an enormous societal impact. And that would be interesting. But I was always like, look, at most, I could do 6 sessions a day, I think. My brain doesn't work in problems that don't scale. And it sounds like you found a really interesting way to actually jujitsu that into your current career. Would you say more about where that came from?
My brain is wired to fix problems. I will say I ran my dad's practice for about 10 years. He was an incredible psychiatrist and the world's worst business person. He never should have been allowed near a checkbook or a credit card. And I think, speaking of trauma, watching him as a kid being so bad at business actually made me really good at business. But also watching him be this like little old white Jewish guy that all of these people would bring their problems to and feel comfortable talking to him about it when he had almost none of the intersectional identities that his patients did. There was always something there as far as that piece of you can do this work and still be human. You can do the right thing in business and still be human. I think by the time I took over my dad's practice, he was already past retirement age. He worked until about 5 weeks before he died. His initials were LBE, and we called him LB. So he's the LB in LB Health. I had no experience in what I was doing. And I had to learn fast how to run a practice, how to bill for things, how to get paid for stuff that we could keep the lights on. Because despite practicing for almost 50 years at that point, it was still a relatively new practice. I learned a lot, but I learned it in the framework of if it's the right thing to do for humans who need care, do it and we'll figure out how to pay for it in the long run. And it worked out every time. We did things that people thought made us absolutely crazy. Never anything that was unethical, never anything that was bad medicine. But we did telehealth in 2013. people thought we were losing our minds. And I was like, you didn't think my first call was to my malpractice insurance to make sure this is okay? All right, whatever, man.
Yeah.
I remember how I'm good at the business part of things. And so really being in that environment where it was just like, hey, can we do this? And him being like, there's no reason why we can't. Let's try it. And building a couple of programs so that by the time I moved on, we were a multi-site clinic with a giant consulting wing. And I had no idea what I was doing. It was just figuring it out. And so that was just really instrumental in showing me that there are people who are going to get lost in the red tape and they are probably missing. I think the thing that worked best for us is I didn't know what red tape to look for. So I
Right.
couldn't get caught
Just
up in it
blasted
because
through it all.
I didn't know it was there. My dad used to tell me all the time that I never realized I couldn't do something until I'd already done it. Part of it was just having that groundwork of knowing that you could both serve people well and keep the lights on and run efficient, scalable organizations with small, well compensated teams who are bought into what you're doing. But then the other side of it was when I transitioned from there to what I thought was my job, because after running that clinic for 10 years, I was exhausted and I was ready to just go to work and do what I was told and get a paycheck, which lasted all of 6 weeks. Not how I'm wired. But I transitioned to a job where I was going to get a paycheck every week. And for the first 2 years, it was magical and wonderful, and it was a great place to work. And by the time I left, I was so burned out and so traumatized by what had become an incredibly toxic work environment that I had stayed in a lot longer than I should have because I was absolutely convinced that nobody was ever going to hire me, that I had no skills, that they were tolerating me as much as I was tolerating them. And so I just stayed put because I didn't know what else to do. When I finally left unceremoniously, which is very unlike me, I felt like I had so much potential energy built up in my hands and like I had to do something with it. And it just
Did you
started
ever
coming
go back to
exciting.
corporate after that? You're like,
Well,
nah, I'm done with this.
I've worked with a number of companies since, mostly as a consultant. I had a very short stint with one that was like trying to be a giant mental health company. It was not a good fit for me. It was very much like VC powered mental health, which no thanks. But every time I went back, I quickly realized, oh, by the way, I'm a lone wolf and I don't play nice with others and I want to work for myself. Anyway, long story long is after this horrifically traumatic experience where I was certain that I was the only person who had ever felt like this, I started talking about these things I experienced on the internet. I can't tell you why to this day, because the fact that I put my face on the internet and I regularly talk to strangers on the internet, if you knew me 5 years ago, you would laugh because the idea of being perceived by anyone, the idea of going on a podcast, mortifying. Who would do that? Who needs that kind of attention?
Yeah, what kind of crazy person are you? What's going
Exactly,
on?
right? Unhinged. But I had to get whatever this was out. And I really thought that I was going to write these things and I was going to share them. And people were either going to be like, oh, that's so unfortunate that happened to you. Or like, why are you sharing this stuff, like this personal stuff on the internet? This is uncomfortable. And instead, what they all said was, the same thing happened to me. And I thought it was just me. And I went, okay, I've been sitting here thinking that this is just me for 5 years. So is it possible that it's all of us and we're just not talking about it?
Right.
And that conversation about what it was like to work while female and workplace gaslighting and the impact of toxic work environments and how workplace trauma is real eventually led to L2, where we talk about things like that all the time. And we've built this huge following across multiple platforms, which again, mortifying. Um, but saying those things out loud that I never realized that other people were thinking because nobody ever said, yes, this is the topic we don't talk about because we weren't talking about it. And then eventually, after 3 years of finding my way in this space and my business partner and I building 3 other practices, I woke up one day and went, wait a minute, why don't I start a mental health company? Like I have all of those skills. I've done it before. Why have I not done this yet? And it was built on this idea that we've talked about the whole time that isolation lies. Isolation tells you things about yourself that are not true. But the only way to realize they're not true is to get unisolated, is to find whatever safe version of community you can, whether that's online, in person, through smoke signals, whatever, man. And that led us eventually to these much bigger conversations about neurodivergence and neurodiversity. And there's two pieces to it, because there are some people who just need to hear whatever the thing is. They just need to hear it one time. And there's a lot of people like that. They just need to hear that you're different, not broken. And then they go, oh, I'm allowed to be this way. This is not a problem. If it's a problem for someone else, that's their problem. Got it. But then there are people who really need help. And whether that's community-based help, whether it's actual mental health assistance, whether it's diagnostic tools that get them to the accommodations that they deserve and should be afforded in their workplace, whatever. But by having the conversations, we open the door for the people who just need to hear it. And then by connecting it to actual services, we are making the rest of it accessible, because I usually just need to hear it. Once I can internalize it, I'm good. But there are a lot of people who need to hear it every day, or who need to hear it multiple times a week, or who need the skills built to remind themselves of it. And they should not be penalized because they're not one of the ones who can just hear it and internalize it. Everybody's brains are different. That's why we have a varied and wondrous world, is because we had people whose brains worked differently, who saw things differently.
Yeah.
So the scalable part of it is me running my mouth on the internet, which, again, mortified. But the part of it that I think, not that it matters more, but that I think is where the real magic happens, is that we have never believed that we have to help everybody. We have always believed we have to help the people we have access to who are asking us for help. And whether that's 10 people or whether it's 10,000 people, as long as we're doing that part well, the rest is whatever. And so it's a combination of what you said before, when you said, well, then I can only help one person an hour. Yeah, but that one person could turn around and help another one person for whatever reason, or be able to do their job better that facilitates something for someone else. And so scale matters in the message, but in actual tactical day-to-day impact, it's the person who's in front of us at that moment, and the rest is whatever.
Yeah. No, I love that. I'm trying to tease out whether you were driven here by some sort of sense of mission, or whether you saw an opportunity. I was like, why not? Was there a very driven choice that got you to where you are here?
I think it's a combination of things. I am intensely driven towards success, whatever that looks like. And I like working, and I like building stuff. And so if you were to say, what are my hobbies? I really like what I do. And I work too much, but it's not that different to me than if I liked golfing and I was golfing on the weekends. I like what I do. But also, we are incredibly driven, and I say we as an organization, but myself included, by the idea that you can do things differently and still do them better. And then also there's the side of things where this is not a competition. So creating access to things does not mean that the ways that we have done things historically don't have a place. So for instance, we have a very straightforward autism assessment that is only going to test for autism unless you also elect for ADHD. It's very direct. It's very straightforward. We built it that way for a reason. That does not mean there is no place in this world for full neuropsychological testing. And we need those resources too. We're not going to offer it, but we need those resources too, because every now and then we have somebody come through and go, this isn't autism and I don't know what it is. And we think you need a full battery of testing. Let's find you someone who can do that. That takes pressure off of this bigger infrastructure that does not have the capacity to test all the people who need to be tested. But we still need that.
Well, and
But
that's
then,
one way that startups are able to do really well, right? Focus is a gift, to be able to do what you do. And if you're able to say, well, this is not autism, but you should probably go and talk to a neuropsychologist, or this is autism, but also you should still go talk to a neuropsychologist because there might be other stuff going on.
Yeah, the number of times that we see people where it's like a hair's distance between complex PTSD and autism, and like they meet all the criteria for autism, and so it's probably autism, but that doesn't mean that it's also not an intense and difficult trauma history that probably sprang out of the fact that they were abused because they were autistic.
Right. So it's all super connected. The other thing that seems to be springing up in the literature at the moment is the number of women that were diagnosed with ADHD and a clinician stopped there rather than asking a few more questions and going, well, actually, ADHD and autism have a huge comorbidity rate. Maybe we should take a look. So,
well,
I think
and we're only very recently getting to the idea that women can be ADHD, period.
Right.
So there's so much of this that is emerging now. And I think the hard part of that is a lot of the people who are getting to their diagnosis or not getting to a diagnosis because it's not appropriate feel like they should have been there 20 years ago.
Right.
And that's tough. And there's just not a lot that you can do about that, aside from root out kind of the dinosaurs who are holding on to this much more traditional diagnostic perspective that even our big book of things moved away from over 10 years ago.
Right. Yeah, totally. So I imagine, I'm just making up a conversation here because I haven't actually spoken to somebody, but I imagine a classical psychiatrist who does like a 10-hour battery of tests and all that kind of stuff looks at what you're doing is, well, that is not a valid diagnosis. That cannot possibly be a valid diagnosis. How do you respond to something like that?
I'm sure there are people out there who say that. We haven't seen a ton of them. In fact, the people who have been more likely to say that to us have been completely uncredentialed people. And so that's a thing.
Trolls on
But
the internet are going to troll on the internet.
it's been a blast. I think the bottom line is the work that we are facilitating, because that's what we're doing, is being delivered by hyper credentialed and qualified neuropsychologists who are comfortable putting their license number behind a diagnosis. And that means that it's a valid diagnosis because a person who is qualified to make it did it. Now, our literature has always said that autism is a clinical diagnosis. It has never said that you have to do testing to make a diagnosis of autism.
Right.
Testing gives you data, and data is always good to have. But the reality is that the kind of complex and varied requirements for testing and large batteries of testing come in when you're talking about things like insurance coverage or disability services and things that non-clinicians create standards for to make sure that they are not paying more money than they need to pay for services that are not required. It's more a function of medical necessity being an insurance or a funding term, let's put it that way, than it is a clinician saying that this is medically necessary. Now,
Right.
are there clinicians who have been in the space for a long time who probably feel the same way and know that, for whatever reason, feel that it needs to be done that way? I'm sure. Not a ton of them have come to talk to me. That might be because they think I'm a crazy lady who doesn't deserve their time, and that's fine. It might be true. But if you start looking at why does this diagnosis only matter if it's confirmed by the ADOS,
Mm-hmm.
the reality is that is often an insurance company saying, if you want access to benefits, we need confirmation on this universal standardized testing rather than clinical judgment. Confirmation and testing is always great. Over-reliance on testing or the assumption that the testing has to be done in order for the clinical judgment to be valid,
Right.
that's not great.
Yeah, for sure. And the interesting thing is, like, we have a really flawed structure and framework for diagnosing anyway. Like, the DSM-5 is objectively garbage, and that is the tool everybody has to use, right, in order to fall under various billing codes and whatnot. And in the process, you're actually, well, it's the cover of the book says disorder.
Yeah.
You're literally disordering people in order to be able to access services. Even for people, and I'm not going to say that autism isn't heavily disabling to many people, but it's interesting, right? Where if you need to access services or need to get help, I feel there's a conflict there for a lot of people.
Yeah, I'm not of the mindset that the DSM-5 is the problem. I think the idea that the testing that we do has to tell us what the DSM-5 says is where the conflict shows up. I'm sure there are 1,000 different schools of thought on this. And I always say we're fighting the system while working within the system. And so
Right.
it doesn't serve us as an organization to have big feelings about the DSM-5. It just doesn't. Like, that's what we have to deal with. That's where we are. Like, we have to figure out how to interpret what's there in a way that meets our much more evolving understanding of what these diseases, diagnoses, disorders, whatever are. But in the same way that we talked about before, you can take the criteria that are there and ask the questions differently to get to them. And it's still valid. That's still considered acceptable. Would I like to see much more flexibility in them because it shouldn't be so hard to get to female, femme, non-binary presentations that meet the DSM-5 criteria Yeah, but there is a way around it. And fighting the system means, which we do, means that eventually we'll expect a full overhaul. But in the meantime, I
Right.
can't do anything about that. But what I can do is say, okay, here's what social and emotional reciprocity really means when you're talking about somebody who has been thoroughly abused to believe that the way that they stim and fidget when talking to people is uncomfortable for other people and somebody else's comfort is paramount. So here's what
Right.
that means in this environment. How do we ask those questions to find out if they're true? And I
Yeah.
will say that I expected a huge amount of over reporting on our assessments. I really thought we would have people who come in and just say yes to all of the things that look like an autism, right?
Hmm.
And it was one of the things that I was most concerned about in taking the structured interview route, especially with the written one, because I just thought people were going to go through and go, all the answers are supposed to be yes. So yes, 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 yes. We
Right.
literally have not seen that at all. So much so that the validated assessment that we use, sometimes we get incredibly low scores on it, usually from women. And that is a higher indicator to us or to our
Mm,
clinicians that they probably fall somewhere on the spectrum. Because if they're answering with their first instinct, and their first instinct after all these years is don't do that, don't do
right.
that. So our clinicians actually ask questions twice in a lot of
Hmm.
cases. So they'll say, like we talked about earlier, have you ever had a meltdown in public? No. Okay. Have you ever had a time where you felt like you might burst into tears in public and you had to try really hard to control it? Yes. That's the same question, but one is the question and one's the question with the perspective of socialization. And so our clinicians are trained to go through, and sometimes they literally ask the same question exactly the same way. Have you ever had a meltdown in public? No. Can you think about that? Do you think that's ever happened before? And they go,
Right.
well, maybe there was one time, and then it turns out there was 10 times.
Right.
Because women especially are taught to answer questions the way they think they're supposed to and not the way that they actually feel.
Right.
And when you push on it a second time and go, I want you to think about that and answer it again, they go, oh, okay, I'm taking the mask off. All right, there was a time, and they're usually mortified by it or so embarrassed by it. And it's just, okay, no, that makes sense. That's right. And all of a sudden, it's like, you mean I'm able to say stuff like that and you're not immediately writing down weirdo on your
Right. Right.
chart?
Right.
And you're like, no, we did that an hour ago. Don't worry about it.
Yeah, yeah. We already got you down as weirdo. The
Yeah.
first therapist I worked with eventually said to me, hey, I am here to help you. I don't have to like you. And I was like, oh, shit, that is actually very helpful because I've noticed I was masking to this person. I was like, well, I'm actively sabotaging my own healing by not telling
Right.
my full truth to the person who I'm literally paying to deal with this.
Right.
Right?
My dad, people used to ask him all the time, what is it like to listen to people all day? Like they come in and they tell you all of their sad stories and you have to listen to them all day. And his answer was always, who listens? And it sounds funny. And that was his sense of humor. But the reality is that what you say is not giving us most of the information. It's important and we document it and we look at it. But the way you respond to how questions are asked, the way you process the information we just threw at you, the comfort with which you answer the questions, all of those things matter as much as the actual answer. And it's how we know, or how our clinicians know, I should say, that they need to ask the question a second time.
Right.
Because there was like a moment where it was like, oh, nope, here's what I'm supposed to say. And they know
Right.
that's the cue to go back and ask it again.
That's so clever. Hey, I promised I would keep this to under an hour, and I've already broken my promise, and I would be delighted to talk 5 more
A lot.
hours.
I'm sorry. I talk a lot.
No, don't apologize. This is a podcast. This is exactly what I signed up for. But I will be respectful of your time and those of our listeners. I have a couple of final questions I love to end on. The first one is, what do you wish people, neurotypical people in particular, really understood about autism?
I wish that they understood that it really is a spectrum and that autistic people do not exist for neurotypical comfort. So asking them to change their behavior that is not abusive or egregious in some way and is just something you're not used to or what you're supposed to do doesn't serve anybody, because what can come out of an autistic brain when it is allowed to exist as it is can blow you away. And that isn't to say that all autistic people are exceptional in all ways. Everybody's exceptional in a different way, or everybody has their own ways where they thrive. But autistic people do not have to exist in the world for neurotypical comfort.
I love that. Thank you. And my final question is, can you tell me of a time when you were seen and loved exactly the right way for you?
Ooh, that's a good question. I'll tell you a story. I'm not like a big stuff person, like gifts and stuff. I appreciate it, but it's not what speaks to me. Every night when I go upstairs, I say, "Hey Siri, turn on the master bedroom light." She's about to talk to us now because I forgot that we are anyway. And it turns on, obviously. Sometimes I have to yell at it a couple times. And if my phone's in my pocket, it turns on. So not that long ago, my husband, who usually is sitting out on the couch in our loft, which is right outside of our bedroom, I heard him go, and because I said it 3 times, and I heard him go, "Just wait." And I was like, I found out that it hadn't been working for like months. And every time I walked upstairs, he would know I was going to go yell at Siri to turn on the bedroom light. And so he was just turning it on his phone. And I looked at him and I was like, "What are you talking about?" He's like, "It's just easier to just do it. Like, I'm sure." He's like, "I haven't had a
Moonlighting
chance
as Siri.
Exactly. He's like, "I just haven't had a chance to fix it yet. And it was easier than explaining. And then you'd have to go look for the remote. And that would be," and he was like, "I just knew that would be a thing. And then you're going to lose the remote all the time. So it's just easier to just turn it on." And I was like, can you imagine knowing me so well to just know that it is so much easier and better to just have the light on when I walk into the room, make me think that I'm magical and could speak to whatever powers that be, turn on the light. He did eventually fix it after that because the jig was up. But to this day, if I have to give an example of why our relationship works, even though it's often very weird on face, and we're not the type of people who are like super affectionate, like we call each other dumbass all the time. It's like a thing. But that was the moment where I was like, man, this man knows me so well. And
Love
it was
that.
so silly. It was so silly. But to this day, I'm like, that was a good moment.
I love it. I really love that. Thank you so much for joining me. This has been an absolute delight, and thank you for doing everything you do.
Of course, it was so nice to meet you.
Thank you so much for tuning into today's episode of the podcast. You can find us over on TikTok at Autistic FM, on Instagram at autistic_FM, and of course online at autistic.fm. This podcast is lovingly produced and hosted by me, Haje Kamps, with the editing magic performed by Sean Portillo. It's been an absolute pleasure to have you with us as we delve into the world of neurodivergence with L2. Her insights into improving adult autism assessments were eye-opening, and in fact, her company is going to be doing my diagnosis probably around the time that you hear this. Very exciting. As usual, I want to leave you with a fun random fact to tickle your brain. Look, I'm a linguistics nerd. I love language, I love words. And I have a pervasive fascination with collective nouns. They're like the secret club names for groups of animals, and they often have hilarious backstories. Like, a group of crows, for example, is called a murder. It sounds like something out of a mystery thriller, right? But I think best of all, because a collective noun is for 3 or more of something, a pair of crows is obviously, well, an attempted murder. A group of owls is called a parliament, as if they're all busy debating the latest owl issues at midnight. So where did all these words come from? Well, it turns out back in the day, wordsmiths, hunters, poets, people sitting around the bonfire were cooking up these quirky names to add a dash of drama and personality to the natural world. Even today, these playful terms keep our language lively, whether you're laughing at a flamboyance of flamingos showing off their style, or a prickle of porcupines bristling with attitude. You've got a little slice of history mixed with some creative language fun. It's like all these little vintage nicknames that stuck around because they're, well, too cool to ignore, and I just love it. It's such a wonderful quirk of language. So the next time you see a group of animals, imagine them meeting up for their own little quirky club night, sharing stories and making the world a little bit more entertaining. And if you don't know what their collective noun is for them, make it up. That's part of the fun. Anyway, thank you for being here and see you next episode.